Good evening, everyone. So, my next video is on the topic undesirable drug-drug interactions. And before I start my video, I want to request you if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you undesirable drug-drug interactions. First of all, antacids and NSAIDs. Tetracyclines, H2 blockers, and iron. They form the chelating complex with these antacids. They form chelating complexes with these drugs like NSAIDs and tetracyclines, H2 blockers, iron, and to decrease the absorption of these drugs. So these drugs have to be given with a gap of 2 hours of each other. These antacids and these drugs have to be given at a gap of 2 hours from each other. Digitalis and furosemide basically they causes the hypokalemia. So this furosemide causes the hypokalemia. So it will lead to digitalis toxicity. Digitalis toxicity is potentiated due to hypokalemia caused by the diuretics like furosemide, and this digitalis competes with potassium ion. Means if there will be potassium binding of potassium ion will be less, so the binding of the digitalis to the potassium ion will be less, so it will lead to digitalis toxicity on the sodium potassium ATPase pump. On the binding of the digitalis to the potassium ion will be less, so that will lead to digitalis toxicity. And this digitalis should be given with potassium sparing diuretics, which causes the hyperkalemia, and spironolactone. These can be given in combination with potassium sparing diuretics like spironolactone, digitalis. And rifampicin, phenytoin, phenobarbital, these are enzyme inducers. So these will induce the metabolism of oral contraceptives, leading to contraceptive failure, oral contraceptive failure in the reproductive age group female. Now, ketoconazole and terfenadine is that the ketoconazole is the cytochrome P450 enzyme inhibitor. It will lead to increase in levels of the cisapride, which is the prokinetic drug, and the terfenadine, which is the antihistaminic drug. The levels in the body will increase. That will lead to arrhythmogenic effects like there will be torsades, pointes, ventricular arrhythmias, tachycardias, palpitations, QT prolongation can occur. Again, erythromycin is the enzyme inhibitor. It will lead to increase in levels of the terfenadine, erythromycin, and ketoconazole and estimazole, which is the antihistaminic drug. Erythromycin metabolism inhibits the cytochrome P450 enzyme and increase the level of concentration of these drugs. That can lead to again QT prolongation, torsades, pointes, and ventricular arrhythmias, tachycardias. All these will be seen when the toxicity of these drugs will occur due to intake of the erythromycin along with these drugs, because erythromycin is the enzyme inhibitor. Levodopa and pyridoxine is that pyridoxine vitamin B6 it inhibits the peripheral decarboxylation. Sorry, it increases the peripheral decarboxylation. So more of the dopamine will be peripherally decarboxylated metabolized. So less of the levodopa will be available to be used to be given to the CNS, because it will be levodopa will be peripheral decarboxylated in the body. So less of the levodopa will reach the CNS. So that can lead to therapeutic failure. And if vitamin supplementation is to be given, it should be given without vitamin B6. Means when we give the levodopa along with vitamins, so we have to see that it is pyridoxine or vitamin B6 is not given. Sulfonylureas and beta blockers. This is the beta blockers propranolol. Beta blockers delay the recovery from hypoglycemia caused by oral hypoglycemic agents. Now, they delay the recovery, means when we give the sulfonylureas, they cause the hypoglycemia, and beta blockers, they also mask the signs and symptoms of the hypoglycemia. How? The signs and symptoms of the hypoglycemia are tremor, tachycardia, sweating. And these beta blockers, they act on the receptors beta 2 and they block the beta 2 receptors, so there will be no tremors, and they block the beta 1 receptors, so there will be bradycardia in place of the tachycardia, and also the sweating will not take place. So means the symptoms, they will be counteracted, they will be masked. These hypoglycemic symptoms will not come when the beta blockers are given. So the patient may go into hypoglycemic coma without underknowing, without knowing the symptoms of the hypoglycemia. A diabetic patient who is also taking beta blockers, signs and symptoms get masked, leading to severe hypoglycemia and may lead to coma. That is, the symptoms are tremor, tachycardia, sweating. Phenytoin and cimetidine. Now, cimetidine again, it is the enzyme inhibitor and it decreases the metabolism of the phenytoin. So it will lead to phenytoin toxicity, marked increase in concentration. Cimetidine is enzyme inhibitor, so marked increase in concentration of phenytoin, resulting in the toxicity. Like other drugs like famotidine, which is another H2 blocker, and pantoprazole, omeprazole, which is the proton pump inhibitor. These are not the enzyme inhibitors, so these can be used in place of the cimetidine. Beta blockers and verapamil. Beta blockers also cause bradycardia. Verapamil also cause bradycardia. Means it decrease the cardiac, have the cardiac depressant action. They will lead to bradycardia, AV block, and there will be depression of the myocardial function. So there will be enhanced effect. Nifedipine may be used along with beta blockers whenever required. Because we do not give the verapamil, which is the phenylalkylamine. We give the nifedipine as the calcium channel blocker along with beta blockers, as it is not the cardiac depressant. It causes the reflex tachycardia by causing the vasodilatation. Nifedipine. Aminoglycosides and amphotericin B, both of these drugs, they cause the nephrotoxicity, and even when they are given individually, they cause the nephrotoxicity. So there will be increased risk of nephrotoxicity when given together, especially in patients with compromised renal function. And theophylline and ciprofloxacin. Ciprofloxacin decreases renal function clearance of the theophylline. So theophylline toxicity can occur because it decreases the clearance of the ciprofloxacin decreases the clearance of the theophylline. So theophylline, it has a narrow therapeutic margin, so seizures can occur. Levels of theophylline can increase, leading to theophylline toxicity. So there can be arrhythmias, GAT functions, CVS functions, CNS functions, like side effects can be there, like seizures can occur. Warfarin and aspirin is that they decrease platelet aggregation, causes enhanced anticoagulation. Note, in high dose aspirin and indomethacin decreases the warfarin from binding site, raising plasma concentration. Means the warfarin levels will increase, and also the aspirin, as it decreases the platelet aggregation, it will again cause the enhanced anticoagulation effect, and the levels of warfarin again get increased as these displays from the plasma protein binding sites. Warfarin is displaced कर देते हैं उसको warfarin को, so there will be increased anticoagulation, so bleeding tolerance will be there. Again, more bleeding will be there. Disulfiram and alcohol is that the alcohol is metabolized in the body to acetaldehyde, which is to further metabolized by the aldehyde. This the alcohol gets converted to acetaldehyde by the action of alcohol dehydrogenase, and the acetaldehyde gets converted to acetic acid by the action of aldehyde dehydrogenase. And this disulfiram, it inhibits the enzyme aldehyde dehydrogenase, and the levels of acetaldehyde in the body it accumulates in the body. So this acetaldehyde is responsible for sweating, throbbing, headache, nausea, vomiting, confusion. Disulfiram, like if it will come, it will produce these effects because of the accumulation of acetaldehyde in the body. So these drugs should not be given in the combination with the alcohol. Means alcohol and disulfiram and metronidazole should not be given, as these drugs are the acetaldehyde dehydrogenase inhibitor. So levels will increase on the acetaldehyde in the body. So that can lead to sweating, throbbing, headache, nausea, vomiting, confusion. Thank you. That's all with the undesirable drug-drug interaction. I hope you understood. Thank you. Be happy and please subscribe to my YouTube channel if this video is useful to you. This is Dr. Nitika, pharmacology discussion. Thank you. Be happy, be healthy, be wealthy, be blessed, be happy learning. Thank you.